A foundational principle of effective crisis response is to understand the scope of the crisis and to understand the dimensions of the crisis and the risks that the crisis represents. I believe that there is something unprecedented happening in COVID-19, and that is we have simultaneously 7 different kinds of crises in one. Think of these as the 7 dimensions of the crisis. The starting point is a public health crisis, with numbers of people sick and dying and growing exponentially, and more people will become sick and die before it gets better. This is putting a meaningful strain on the American health system, and many hospitals and intensive care units are at or close to capacity, and there is a shortage of personal protective equipment and a shortage of basic medical supplies that would otherwise be needed in a situation as serious as this. The second dimension is we have business crises that are very similar to more traditional business crises. There's an effect on revenue, there's an effect on cost, there's operational disruption, there's an effect on employees. But unlike most corporate crises where a particular company or sector or geographic region is involved, here every institution across the United States and beyond the United States is potentially severely affected by the business problems that are represented in COVID-19. We also have a potentially profound economic crisis. 2 months ago, the smart thinking was that a recession was not likely this year. Now, a recession is very likely, and it could be even worse than a recession. There is significant economic anxiety, there's significant economic risk. Governments are now doing unprecedented things in order to alleviate the situation, but everything we are doing is now in an environment of economic risk. We have an information crisis. There is incomplete, incorrect, sometimes intentionally misleading information in the information environment, and as a result there is confusion about whom to believe, what information to take seriously. There's confusion about how the virus is transmitted, how to protect ourselves from the virus, the course the virus typically takes when it infects a human being. That information crisis is making it harder and harder to have a common understanding of the crisis and ways to get through it. We also have a competence of government crisis. We have yet to see in the 3rd month of the pandemic in the United States a whole of government response. Rather, we have a fragments of government response. The federal government is hit and miss. Some states are doing remarkable things, but some states are doing things that experts say are counterproductive. We need to get the government moving in the same direction. We need a whole of government response if we are to get through COVID-19 less badly than we otherwise would. We have a social crisis. We have people who are scared and who are angry and who are acting out, and there's a number of people who have been the targets of incivility and violence, sometimes because of their perceived national origin, sometimes because they're wearing or failing to wear a mask. But in this environment of incivility that is coupled with social dislocation, there is increasing risk of interpersonal harm, interpersonal violence, and we need to take that very seriously. And then finally, we have a mental health crisis. We have people who are scared about their own health, about their jobs, about their family's health, about their family's well-being. Many are sheltering in place or in quarantine, and they've never had to do that before. This is an environment where mental health professionals are needed. I know at least one state has asked for mental health professionals to volunteer to help those who are not currently under their care to make the situation better. Effective leaders need to focus not on any one of these dimensions of the crisis without regard to the others. We need to take all 7 seriously because those who matter to our institutions are suffering the consequences of all 7 dimensions of the crisis.